board certified plastic surgeon, Ivy League trained, went to probably one of the best plastic surgery residency programs in the nation at Duke. So yes, I know what I'm doing. Okay? All right. So
Good one.
what's that?
President.
Yes.
Of
and
what?
the president of the World Association of Gluteal Surgeons. That's right. Okay, so today I decided to take a little bit of a different approach. So rather than just talk about all the procedures that we do, and of course, go over their, complications or what to do and everything else. Today, what we're gonna do is we're gonna talk about how to go from SpongeBob to Jessica Rabbit. That's right, because at the end of the day, this is what the patients want, right? They want this or something similar. So now we're gonna kind of take it from the patient's point of view. Okay, so you're a patient, you're not completely happy with the way things look, and perhaps you don't even know where to start. What do I do? What do I do if I want to take this SpongeBob SquarePants body, all right, and turn it into something a lot more like Jessica Rabbit? Okay, so I'm gonna kind of break this down, and then we're gonna go over like what questions you have to ask yourself. And then based on those questions, then we can talk about what procedures would probably most benefit you. And then based on that, of course, we always have to talk about realistic expectations and whether something like this would take more than one procedure, which honestly, in most cases, it does. I mean, if you're truly starting out with a SpongeBob SquarePants body, in order to go from here to here, it's very challenging, probably almost impossible to do that in one surgery. So when we had to operate on SpongeBob, it took multiple rounds to get him to look like Jessica Rabbit. Okay, so here we go. So what are the initial questions that you need to ask? All right, so first of all, kind of starting from the top to the bottom, we'll start with the breast. So A, are you happy with the breast? Okay, do you feel like you would like more volume to the breast? Or are the breasts droopy? Okay, so if you're happy with the breast, great, nothing needs to be done. If you feel like you need more volume, then of course that would be a breast augmentation. If the breasts are droopy, then we're talking about a breast lift plus minus an implant, okay? And last I hadn't mentioned it, but what if you feel like your breasts are too big, right? Then we can talk about a breast reduction, okay? So starting from top to bottom, then we talk about the breast and figure out what it is that you want to do with the breasts, okay? All right. As we go down, we then talk about the body, okay? So now the body, we gotta break it up into a few different sections. One of them, the first one being fat. So is there excess fat? Are there areas where there's too much fat? Okay, so a lot of people complain of fat in kind of the trunk area, the abdomen, especially that waist area. A lot of women don't like the fat in the back, especially along that bra line area or in or around the armpits area. So is there excess fat? Probably the answer would be yes. So the next question is, well, where is the excess fat? What are the areas that bother you? Where in the trunk? Does it also include the arms? Does it include the thighs? Okay, does it include the chin? All right, so you got to determine where you have the excess fat. And it can be the very same body, is there areas with lack of fat? So just because you have excess fat in certain areas that you don't want, there may be actually a lack of fat in other areas. For example, the hips and the buttock. Okay, so where do you find that there's a lack of fat? Well, if you have hip dips, the only way to fill a hip dip is with adding volume, and the best way to do that is with your own fat. Exercise will not fix a hip dip. Okay, there's no muscle there to build. Anatomically, it's impossible. Okay, so the only way to fill a hip dip is by adding volume, and the best way to do that is to use your own fat. Okay, or what about the buttock? Well, if you do a bunch of squats and you build that muscle, can you build it up? Yeah, potentially you can. It's going to take a very, very long time. It's going to be a lot of work. And sometimes, you don't want like that hard kind of muscular buttock. You want more of that softer look, okay? Well, in order to achieve more of that volume and a bit more of that softer look, then rather than building muscle, we can add fat. And of course, we can add your own fat. So that's why you want, these two things typically come together, okay? So where is there excess fat? Where is there a lack of fat? Those are the next two questions, all right? But Fat, okay, so procedures that we use to deal with fat are not necessarily the procedures that we use to deal with excess skin. So the next question is there areas where there's excess skin? Okay, so perhaps you had a pregnancy or multiple pregnancies, or perhaps you had weight fluctuations or massive weight loss. Well, all these things are going to lead to excess skin in certain areas. Where could these areas be? Well, the most common, or one of the most common, is of course the abdomen. Other common areas can be the arms, it could be the chin or the neck, it can be the thighs, and it can also be in the back. It can be the upper back or in the lower back. Okay, in lower back including the buttock. So, especially for massive weight loss patients, there may be multiple areas where you have excess skin. Okay, so now we're really coming up with a plan of all the areas that you would like to improve. Okay, so we talked about breast, where there's too much fat, where there's not enough fat, and where there's excess skin. But we still have one more thing that we haven't addressed, and that is, well, what about the muscles? And specifically, I'm mostly talking about your abdominal muscles, okay? Because these are the ones that will become, spread apart with pregnancies, especially multiple pregnancies, especially twin pregnancies, okay? Or with, massive weight gain followed by, massive weight loss, okay? So the muscles can get spread apart, or they can become weakened, okay? The muscles of the abdominal wall may become weak, okay? So this is one of the last questions that we need to ask, but it's very, very important because it's going to determine what needs to be done and also the order of how things should be done, okay? So muscle separation and or muscle weakness, okay? So these are the first questions that you need to ask, because based on the answers of these questions, then we can formulate a plan to take that SpongeBob to Jessica Rabbit, okay? So let's see, for example, we have a patient that says, well, so I've gone through the questions, breast, I have a lack of volume to the breast. I would like my breast to be more full. Right now I'm about a, A or B cup, and I would like to get a full C cup. But fortunately, I don't have a lot of droopiness to my breast, and the nipple position right now is above that inframammary fold, so I don't believe I have any breast droopiness or ptosis. I do have excess fat around my trunk area. I have excess fat in my belly, in my back, especially in the flanks, that tire that people talk about. I would love to get rid of that. I do also have a little bit of excess fat in my arms, especially near that armpit area. It's a very common area there. So yes, I have some excess fat there that I would love to get rid of. But at the same time, I have hip dips, which I don't like. I would love to be in that dress and have that nice kind of hourglass shape. And right now, when I'm in a tight-fitting dress or I'm wearing those leggings, it's not a nice kind of smooth curve. Things kind of go in and out. So I have those hip dips. I would really love to get rid of that. And while I'm there, I like to have a little bit more volume to the buttock as well. I don't want to do anything crazy. I don't want to look like an ant booty or a diaper booty, but a little bit more volume would be great. I did have a couple of pregnancies, so I have 2 children, and that has led to some excess skin to my lower belly, as well as a diastasis or separation of my abdominal muscles, and some weakness to my abdominal muscles as well. Okay, boom. So now we've asked the right questions, we can make the right diagnoses, so now we can formulate a plan. Well, what I'm going to say is, well, Barbara, thank you for coming in and thank you for being so thorough about everything that's going on. And based on everything that you've said, well, it's going to take at least 2 surgeries to get you to where you want to be, which is much closer to this Jessica Rabbit, okay? The first surgery that I'm going to recommend is a mommy makeover. So we're going to be recommending 2 stages. And stage 1 is going to be a mommy makeover, where we're able to combine the breasts, okay, along with the issues of the excess skin and the muscle separation. So during that surgery, we'll be able to do your breast augmentation and your tummy tuck. Along with your tummy tuck, we'll be able to do your muscle repair as well. And we'll start contouring the body. We're going to do some liposuction to the flanks and the waist to already come out with a more curvy figure. So rather than this kind of straight SpongeBob shape, we're already going to start taking in, the areas of the flanks and the waist to start creating that shape, okay? But we're not going to be done, okay? So especially here in Florida where we do have rules, we're not able to remove more than 1 liter of fat at the time of a tummy tuck, and therefore we can only remove that 1 liter in the flank and the waist area, and there's going to be some other excess fat areas that are going to be taken care of at a second stage. Therefore, I'm recommending stage 2. Stage 2 is when you come back for your liposculpture 360, plus the lipo to the arms, because you mentioned that as well, and your fat transfer to the hip and buttocks. Okay? And boom, we have a beautiful plan to go from that SpongeBob to that Jessica Rabbit in 2 stages. Okay? So that's example number 1. Very, very common example. That's like your typical example of someone who's been in relatively good shape throughout their lives, that they've had 1 or 2 pregnancies, and so they want to kind of get back to that pre-pregnancy body, okay? Because unfortunately, even though pregnancy and having children is a beautiful thing, it does tend to kind of cause the reverse. If you wanted to go from Jessica Rabbit to SpongeBob, pregnancy can aid to that. Of course, not exercising, poor nutrition, weight gain will also cause all these things in the reverse order. And then it becomes very difficult to just go back simply with exercise and diet alone. Because exercise is not going to fix a hip dip. Exercise is not going to fix the muscle separation. It's not going to fix excess skin. Okay? So I'm not saying that you don't need to go back to the good habits. Definitely the best combination is all 3. Proper nutrition, of course exercise, and surgery to get you back to where you started. Okay? Alright, and I'm going to give one more example before we then get into all your questions. Alright, so I gave you the example of, typical kind of mom who's had 1 or 2 kids. The other very common example, especially nowadays, is the massive weight loss patient. Okay, so today we have these injections, which I think they're just absolutely fantastic. It's been a tremendous breakthrough. So we have these weight loss injections such as the semaglutide, and you can get that here at Pure. Semaglutide, Mounjaro, okay, all these GLP with GLP-1 agonists, all right, but injections that allow you to lose significant amount of weight. So bariatric surgeries, it's really almost no longer necessary. Maybe just for very, very few people, but now you can have lots and lots of weight loss only with injections. No need for a gastric bypass or gastric sleeve or any sort of bariatric type of surgery. And we've had patients lose 20, 30, 40, 50 plus pounds with these injections, okay? And that's great because that puts you on a path to health, and a path to better nutrition, and a path to being more mobile, being able to do better exercise. But what's the downside? Downside is that you get what they call Ozempic body, Ozempic face, right? The skin is not able to retract back. So when you have the massive weight loss, you're going to have excess skin in several areas, and you're probably going to have some muscle separation and muscle weakness. So once again, a massive weight loss patient, okay, you're going to ask the questions. Well, breasts. Well, the breasts, I've lost 60 pounds, and my breasts have become deflated. And so now we have kind of these empty bag type of breasts. There's no volume to them. There's just a bunch of loose skin. And they're very, very droopy. Excess fat. Well, I lost all this weight. I don't really have that much excess fat. I have a little bit, and there is certainly a lack of fat to my hip and buttock area. But mostly really it's excess skin. I have a lot of excess skin to my abdomen and my arms as well. And I do have some weakness of my muscles and some separation of my muscles also. All right, great. So, well, I say, all right, Mrs. Jones, well, thank you for going through that thorough analysis. And we can come up and formulate a plan. Well, I'm going to say, well, I think the first thing that, kind of the most that we can do in one surgery is going to be the trifecta perfecta. All right, so that's what one of our signature surgeries here at Pure Plastic Surgery. And there we can address the breasts, We can address the excess skin in the arms and in the abdomen. We can address the muscle separation as well, okay? And so we're gonna put all that together in the trifecta. So that's gonna be surgery number one. Again, it can be done here in office-based surgery, outpatient surgery. And we're gonna be doing a breast lift with implant combined with a tummy tuck, muscle repair, some liposuction to the flanks and the waist if you need it, okay? As well as the arm lift or brachioplasty, okay? We're gonna combine all of that. And that's something that we can easily combine. But what if you say, well, you know, doc, I also have this excess skin in my back and I hate it. Well, that's gonna be a second stage. I'm gonna say, well, come back to the second stage and we're gonna do your bra line back lift, all right? And so we can do that at a second stage, okay? And that's gonna start, you know, kind of coming back, all right, towards more of that Jessica Rabbit body. Okay, now before we dig into the questions, one last thing. If someone actually comes to me and says, I want to look like Jessica Rabbit, I'm gonna say, that's not realistic, okay? All right, having said all this, come on guys, remember, Jessica Rabbit's a cartoon and her proportions are not realistic, okay? So if someone says like, hey doc, I want to look exactly like Jessica Rabbit, I'm going to say, you know, I'm sorry, but that's just not something that's physically possible, okay? But if you come and say like, hey Dr. Earl, you know, I really would like to look less like SpongeBob and more like Jessica Rabbit, well, then I'm going to say, okay, that's great, that's reasonable, and you know, let's formulate a plan for you, okay? All right, ready for questions?
Yes, sir. En español,
Okay,
¿se puede hacer la espalda más atlética con lipo o la lipo solo es para los abs?
No, se puede, la lipo se puede usar, o la liposcultura y la lipo de alta definición, se puede usar para que el cuerpo entero luzca más atlético, ¿ok? So, sí se puede hacer en la espalda, se puede hacer en el abdomen, se puede hacer en los brazos también, es una área muy común. So se pueden hacer todas estas áreas para que todo luzca como mucho más atlético.
Okay. Bariatric patient have loose skin. I'm a bariatric patient and have loose skin on my butt. How possible is it to transfer fat?
Great.
What BMI?
That's actually a very good question because in order to completely answer the questions, I would definitely have to do an evaluation because it really depends on how much loose skin there is, right? So if there's mild to moderate loose skin, then typically that can be dealt with fat transfer. And so for those patients, I would recommend, you know, liposculpture and fat transfer, okay? Now, there are a certain, you know, group of patients that have had massive weight loss, okay? Typically it's when people, you know, when the patient loses over 50 pounds or so, where there is just quite a bit of excess skin to the buttock. It's all just kind of hanging down. The buttock actually has wrinkles from the excess skin, right? So for that type of patient, it's often recommended that they have what we call a surgical buttock lift first, okay? And that way we can remove all the excess skin. At that time, we can do a little bit of what we call an auto augmentation, use some of the tissues to give you some volume to the upper pole of the buttocks, plus a combination of some fat transfer as well to give some more volume to the lower pole of the buttocks to create a better, you know, contour overall. So it is going to depend on the degree of skin laxity in the buttock region. You know, the plan is going to depend on that.
Okay.
All right.
Is it true that Galaflex is sewed into the rib cage?
So some surgeons do that, yes, but not all surgeons do that. And honestly, in my opinion, I don't think it's absolutely necessary. Okay. So first of all, for those that may not know, so what is Galaflex? Galaflex is a surgical mesh, and it's often referred to as the mesh that we use for the internal bra. So what we do with the Galaflex is that we create a sling to hold the implant in place. And some surgeons believe that in order to really create kind of this strong sling where things are not going to move, is that you have to anchor that bottom part of the sling to the actual rib. So they'll put a suture through the Galaflex mesh and then into the periosteum of the rib and you know, basically anchor it down there. Okay? Now, yes, definitely if you do that, that Galaflex is going nowhere, okay? But it can be painful to the patient, okay? Because you are actually, the periosteum, which is that covering that you have over the rib, is very, very sensitive. And so there can be a degree of pain which takes a while for that to eventually subside, okay? I personally don't think that you need to really, I don't think you really need to do that. Yes, you want to grab some good, sturdy tissue, but you don't necessarily need to go into the ribs, okay? So I think if you grab the good, sturdy tissue, you get the best of both worlds. You still have a fairly strong anchor for your internal bra without all the pain associated with, anchoring to the ribs.
Okay. Do you use ultrasound every time for every BBL? Is that mandatory in the state?
Yeah, so yes, definitely. So I would not do and I would not recommend a BBL done anywhere, okay, any state, any country, without ultrasound guidance. I am a super strong believer in that. And I've been doing it years before it became mandated here in Florida. I'm actually one of the pioneers in this procedure. I've had probably the most cases of ultrasound guided BBL of anyone in the US. I've done over 2,000. I've been doing it since 2019. So I'm a very strong proponent of ultrasound guided BBL, and I wouldn't do it any other way personally. But as a patient, I wouldn't go to anyone who doesn't do it this way. Okay. Doesn't matter what state, doesn't matter what country.
Can ab etching be combined with a tummy tuck and lipo?
So ab etching can be combined with a tummy tuck and lipo. Now, for the most part, it's gonna be kind of that, that softer female athletic look where you're etching, the lines in the middle and the lines on the side, but we're not really doing like the cross hatching, okay? So yes, you can do it. You can do that way. You can do like a soft athletic look, ab etching at the time of your tummy tuck.
Can a lift be done without a vertical incision, or is that the standard cut?
Right. So that's going to depend on how much of a lift you need. Okay. So if you need only a very small amount of lift, I would say anywhere from like 1 to 3 centimeters, perhaps. Then you can do that circumareolar or donut type lift, okay? And so that means that you're gonna have scar around the areola, but no vertical, no horizontal scar. But it's only that for those very, very few patients that qualify for that, okay? Most patients are gonna have what we call a grade 2 or grade 3 ptosis or grade 2 or grade 3 droopiness. And for those patients, you're gonna need either a lollipop type lift or an anchor type lift. And so those lifts will definitely have that vertical incision, all right? So what I would say is that for the majority of patients, you are gonna need that vertical incision, yes.
How many surgeries do you perform in a day?
So the max that I would ever do in a day is 5, so that's kind of my own limit. And I think every surgeon needs to kind of do that. They gotta set their own limits, okay? So that in the way that you are putting your maximum best effort for the last case of the day, the same as you are for your first case of the day, okay? So my max limit is 5. Having said that, we are pretty busy, so my average also is about 4 to 5, because we're pretty busy and we're pretty booked out. That is something that also changes over time, right? Right now, I would say I'm kind of at the peak of my level in terms of the combination of energy and experience, okay? But say maybe 10 years down the road, my energy levels, like everyone else's, start to go down a bit. And so therefore I have to readjust. And at that point in time, say my max will be 3 surgeries a day, right? So it's something that every surgeon needs to kind of do a self-evaluation to know how many surgeries they can do where they're giving their full 100% effort the same way for the last patient of the day as they're doing for the first patient of the day.
Doc, en español,
Sí.
¿cómo es el proceso para que tengan una consulta, una evaluación, un precio? Porque preguntan, estamos en Spanish hoy,
Sí,
pero
sí, sí.
on fire.
Excelente, excelente. Bueno, hay que ir, la forma más fácil para una evaluación y obtener una consulta, ¿ok? Es obtener una consulta virtual, que es una consulta gratuita, ¿ok? Y para hacer eso tienen que ir a el sitio web, al website, ¿ok? El website es www.pureplasticsurgery.com, ¿ok? Van a ir al website y ahí en esa página van a ver como un botón que dice Virtual Consult, ¿ok? Ahora, si hablan español y quieren ver el website en español, por ahí hay un icono con una bandera española y si apretan ese icono todo se va a traducir al español, ¿ok? So, el website es bilingüe, todo el mundo, todas las personas que trabajan aquí en Pure Plastic Surgery son bilingües, ¿ok? Así que no tengan miedo, ¿ok? Bueno, van a ir al botón que dice Virtual Consult, ahí van a llenar el formulario, van a mandar las fotos y lo próximo que va a pasar es que una coordinadora se va a poner en comunicación con ustedes, les va a llamar o mandar un email o un mensaje de texto, ¿ok? Y ahí ya se pueden poner en comunicación y ella les va a dar toda la información que necesitan en términos de cuál es la mejor cirugía, los precios, etcétera, etcétera, ¿ok?
¿Qué tan alto puede ser el riesgo de un trombo luego de un tummy tuck?
Ok, es una pregunta muy importante. Es la complicación a la cual más le tememos en términos del tummy tuck, es la posibilidad de un coágulo o un trombo, ok. Por eso hay que hacer ciertas cosas antes de la cirugía para asegurarnos de disminuir ese riesgo, ok. Por ejemplo, no se pueden tomar ningún tipo de estrógeno, ok, pastillas anticonceptivas, y si vienen en forma de pastilla o inyección o IUD, cualquier forma, no se puede tomar estrógenos por lo menos 30 días antes de la cirugía. No se puede fumar, hay que tener cero nicotina en el sistema, cero nicotina por 30 días después, antes hasta 30 días después de la cirugía, ¿ok? Y no se puede tener historial de coágulos y trombos, ¿ok? Si tienes eso en tu historia médica, no vas a ser candidata para el procedimiento, ¿ok? Bueno, esa es la parte número 1. Parte número 2 es lo que hay que hacer después de la cirugía para reducir el riesgo. Hay que caminar mucho, por lo menos 10 minutos cada hora mientras estés despierta, y te vamos a dar un aparato que va en las piernas que ayuda a mantener la circulación, ¿ok? Y ese aparato lo vas a usar por las primeras 2 semanas, ¿ok? Para disminuir el riesgo de trombos. Ahora, si tú puedes hacer todo eso, el riesgo no va a ser cero, nunca es cero, pero es menos del 1%. Si es que haces todo lo que decimos que hay que hacer.
Do you have experience with recurring capsular contractures?
With capsular contracture, yes. So what is capsular contractures? For those that may not know, capsular contracture is when your body forms a wall around the implant and that wall gets thickened or hardened, okay? It's a risk really with any implant. It's something that may happen, and when you develop a capsular contracture, we kind of see it early. There's things that you can do to try to prevent it from getting any worse, or you can actually try to make it better. And that involves breast massage and sometimes a medication that can help called Singulair. Okay? Now, if it continues to progress or it's gotten to a point where you have what's now called a grade 3 or grade 4 capsular contracture, well, that often is going to require surgery in order to remove the capsule and exchange the implant. Okay, so it's not, it's something that we definitely do here. So if someone has a grade 3 or grade 4 capsular contracture, certainly go to the website, put in the virtual consult, and we can help. The surgery, like I said, the surgery typically involves what's called a capsulectomy, where you're removing the capsule entirely and then exchanging the implant if you want that, or sometimes some patients don't want the implant anymore, so they'll have the capsular, the capsulectomy, implant removal, and breast lift.
Okay. Can I have lipo if I have a mesh from an hernia?
Yeah, that's not a problem. So let's talk about the layers of the abdomen, right? So you have your skin, and then of course beneath your skin is the subcutaneous fat, and then you have what's called the fascia, which is a layer that overlies the muscles, then your muscles, and then of course you get into the intra-abdominal cavity where all the organs are, okay? When they put in a mesh to fix a hernia, they're putting it either deep to the muscle or at the level of the fascia. Okay, but they're not putting it in the area where we do the liposuction. Where we do the liposuction is in that subcutaneous fat that's just beneath the skin and above the fascia. Okay, so if you have a mesh, you have a hernia repair, it's not a problem, you can still get liposuction.
Okay, the last one.
All
How
right.
they can book, but in English.
What's that?
For booking, but in English.
Oh, once again? the
Yes,
booking?
but in
Oh,
English, ¿qué
yeah,
le hizo en
yeah.
español?
Okay, yeah, sure, of course. So one more time. So again, if you're looking to get a consult, the fastest, easiest, most efficient way to do so is to get a free virtual consult, and you do that through the website. So you're going to go to www.pureplasticsurgery.com, okay, and you're going to see there a button that says virtual consultation. You're going to hit that button, okay, and that's going to take you to a questionnaire. Make sure you fill out that questionnaire entirely. One of the questions is going to be what procedure you're interested in. Like we said through here, you may need more than one procedure. It's okay, don't worry about it. Just put in one, okay? Just put in one procedure, it doesn't matter. Put in your photos, and then that's going to go through. And then you're going to get a call from one of our coordinators, okay? Once you're on the call with the coordinator, then you're going to be able to go through all your concerns. Okay, she's going to give you a whole bunch of information. She's going to talk about us. She's going to talk about Pure. She's going to talk about the procedures. She's going to talk about pricing, calendars, etc., and kind of just walk you through the entire process there. Okay. Now, if you prefer a video or a in-person consult, that's also a possibility. But again, you can send your information through here. When you talk to the coordinator, you can ask her to then schedule a video consult or an in-person consult. Okay. And if you're on one of these social media platforms, if you're on TikTok or you're on Instagram, you can just shoot us a DM. All right, shoot us a direct message. Say you're interested in the procedure. We'll get back to you. We'll ask for your name and for your cell phone number, and then we're gonna have one of our coordinators give you a call. Okay. All right, everybody. Well, I hope you enjoyed this. I kind of like this. We took it from the patient point of view, but these are the important questions that you have to ask, so that you know kind of we can formulate a plan that's uniquely tailored for you in order to get you back into that Jessica Rabbit body. Okay? All right. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. We'll see you then.